I'm Dr. Sharon Smith. I'm a board-certified obstetrician and gynecologist practicing in the Houston, Texas area. So the subject of travel comes up quite often. It does come up all year. However, I noticed in the summertime it's actually a more prevalent conversation with my patients. So just as a general guideline, it is safe to travel up to 36 weeks by airline within the United States. Optimal time is really 14 weeks to 28 weeks. Other things to remember is I recommend that you avoid Zika endemic areas. However, if you have to travel to areas that are endemic with Zika virus, I recommend you use off with at least 20% DEET. I also recommend that you wear anti-embolic stockings, or those are the little compression stockings that you can buy in the pharmacy. I recommend that you check with your specific airlines for their guidelines on travel with, during pregnancy. I recommend that during flight you wear your seatbelt at all times and follow all the recommendations of the flight crew. Traveling by car, I recommend that you wear your seatbelt at all times. Wear your seatbelt below your belly, on your hip bone, and also to the side of your belly and between your hips. I recommend frequent stops approximately every 2 hours to stretch your legs and decrease your risk of a DVT or a blood clot in your legs. If you're taking a cruise, discuss the possibility of seasickness or motion sickness with your doctor and possible medication. I recommend using hand sanitizers and frequent hand washing to reduce your risk of bacterial infections that can sometimes prevail on cruises. When is travel not recommended in pregnancy? If you are a high-risk pregnancy, any high-risk pregnancy, I do not recommend any travel. If you have preeclampsia or hypertensive disease in pregnancy, do not recommend travel. If you're expecting more than one baby, twin pregnancy, triplet pregnancy, or more, I do not recommend travel in pregnancy. I recommend that you take all your medications with you when traveling. Prescription medications, all your prenatal vitamins. I do recommend also that you discuss all planned activity while on vacation with your doctor. Safe travels!